Okay, good evening everybody. We'll make a start. So I'm Dr. Colleen Bradford and I'm the Director of Training for WAGPET, which is the GP training company in Western Australia. And tonight you'll be hearing from me and also Dr. Georgia Frew, who is our registrar representative who has come to tell you about her experience in GP training as well. So to start with, we shall move on with the slides. So essentially, tonight is about GP training and how to get into GP training. And one of the best things to do is to start thinking about what sort of practitioner do you want to be and what can general practice offer you as a scope of practice as a general practitioner. And general practice is very broad and very interesting. It can be a bit tiring, but I think that's the same for any form of medicine, can be a bit tiring. But the good thing about general practice is you can have a lot of additional special options that you can go into. You can do normal general practice along with some cosmetic medicine, with some skin check medicine, with obstetrics, anaesthetics, ED, surgical assisting. It opens the door. If you get a fellowship of general practice, there's a lot of additional work that you can do as well as normal community general practice as a part of your scope of work. So that's why we find it very exciting, and Georgia can tell you about what she does. General practice has taken me all over the world and all over Australia. So how do you become a general practitioner? We have 2 colleges in Australia that provide a fellowship of general practice. The oldest college is the Royal Australian College of General Practitioners, and the newer college is the Australian College of Rural and Remote Medicine. Both of them give you a fellowship in general practice, and if you choose to work in community general practice, enable you to bill Medicare. Now, how many of you understand what I mean by that when you bill Medicare for a patient presentation? Okay. So are most of you employed at the moment in the state health system? So, no, not employed at all? No, nobody's employed? Okay. So at the moment, if you're employed, if you're an employee of the state health system, the state government is paying you to look after the patients. When you move out into community general practice and you see a patient, you may charge them $80 if it's a privately billing practice, and the government will reimburse $37 back to the patient. Have you all heard of bulk billing? Okay. If you are working in a bulk billing practice, you will charge the patient $37 and the patient will get $37 back, which means they don't pay anything out of their own pocket, but you only earn $37 for that consultation rather than the $80 from a privately billing practice. And that money comes from the Commonwealth government. So we have another part of the government that's actually paying for the care of our patients in the community, and that's the distinct difference. If you are on a GP training program, you become a vocationally registered fellow, which means you get the full $37 back. If you decide to just moonlight somewhere as a practitioner in an area of need, like an after-hours medical deputising service or a rural and remote area that's really desperate for GPs, you would be a non-vocationally registered practitioner and you will only earn 80% of that $37 every time you see a patient, which is why the government wants you all to come into a GP training program so that we have a very high level of service to our patients as fellow practitioners, and also that you will then earn more money as a practitioner yourself. Particularly if you're in a bulk billing practice, you're getting 100% of that $37 each time you see a patient. And I can see all of you are sitting there saying, oh, but if I work in a privately billing practice, I'm getting 80%, or the practice is, and you get a percentage of that income. Anyway, that's why we have a GP training program. It is a specialty training program. We want you to all become highly qualified, excellent doctors who can care for their patients in the community and in the hospital setting, particularly when we talk about becoming a GP in a rural area. So how do you, well, what is the difference between the 2 colleges? They are very similar, but there are very subtle and remarkable differences as well. Now, the Akron College of Rural and Remote Medicine is a mandatory 4-year training program. The RACGP College is a 3-year training program with an additional year which is optional. When you do Akron, you must do a year of core clinical training, which is your hospital training year, which is the equivalent for the RACGP you can see down there, followed by 2 years of primary rural and remote training, and 12 months of advanced specialised training. For the RACGP, if you're really keen and you think you are just going to be a community general practitioner, you're not really interested in doing ED work or working in a hospital, then the RACGP pathway may be more suitable for you, or the RACGP college curriculum, I should say, more suitable for you, which means you'll be doing 12 months of hospital training time, 18 months of community general practice time with the option of a 6 months extended skills post. This could be in a hospital-based discipline or just an additional semester of general practice. It depends on you, what you want to do, how well prepared you are for your exams. Now, if you are enthusiastic and you wish to do your 4th year and get your Fellowship of Advanced Rural General Practice, you need to do that additional 4th year. And there's a bit more information on each of these slides. So for the ACRM training pathway, which has got the detail here, you'll notice that for the core clinical training disciplines, they are quite specific because they really are wanting you to be able to work quite independently out in a rural and remote area. And a part of their training program makes sure that you understand the rural and remote context of the care of our patients, also being able to look after an ED and respond to emergencies, as well as managing inpatient care, and understanding and knowing how to manage patients in a community area. You must do an advanced skill training year, and there are many options. But as we just said to the last group, you might be interested in surgery, and if you have a look at surgery down there, it takes you 2 years. Okay? But where can you work as a GP surgeon in Western Australia? There are about 5 towns where we need GP surgeons, and they are places like Collie River Valley, Esperance, Narrogin, Carnarvon, Port Hedland, Karratha. So if you don't want to work there, don't do surgery as your advanced skill training year. Consider another option. If you're really keen on ACRM or the FAR GP, consider doing emergency medicine. We need doctors with these skills all across the state. We need some GP anaesthetists, we need GP obstetricians, we need people with special interest in Aboriginal health and paediatrics as well. We aren't a very large state. We have some restrictions and limitations on where we can actually train these advanced skill years. So paediatrics is a good example of that. It sounds very exciting and really useful. However, there is a lot of competition for our paediatricians who are trying to train their own registrars in paediatrics. So at the moment we are developing a post, but we don't quite have one yet in WA. Now I'll move on to the RACGP. So you'll see the RACGP is very similar but different. It doesn't have the components of that primary, rural and remote training, which was on the last slide but I didn't talk about, which you must get as a part of your ACRM training, that additional ED and inpatient exposure. It is more that hospital training year, which we would recommend. Is at least a PGY 3 year. You can join as an intern, do your PGY 2 year whilst you're with us doing GP training, and then move into community practice in your 3rd year. However, we have found that it is harder for junior doctors to get a really good, broad clinical exposure with only 2 years of hospital-based medicine. So we would recommend and encourage people to have at least 3. So how many of you are interns at the moment? Okay. So you can join GP training this year, and there's no way we'll stop you. Okay, we're very happy to have you. But if you don't think you're quite ready, we would say join next year. Okay? So apply in 2020 to start with us in 2021 and get 3 years of hospital exposure medicine before you go into a community practice term. How many are PGY 2? So you're sort of the ideal year to come in now, thinking about what you want to do next year. So apply to GP training, but also apply to your hospital saying, hey, I'm a GP registrar. The Office of the Chief Medical Officer is working on a GP project. We are working with the hospitals to get GP-friendly based rotation. So if you haven't had exposure to paediatrics, obstetrics, general medicine, well, you all get those as an intern anyway, but other things like rehabilitation medicine, stuff that's really worthwhile for general practice. We are working with the Office of the Chief Medical Officer to pull together a suite of rotations available for GP registrars in each of our major hospitals. So that's really exciting, in the recognition that we really do need to train our GP registrars well, even while they're in the hospital. So which college is right for you? Now, you can, if you're really enthusiastic, you can do both, okay? Now, the AGPT has two pathways. We have a rural pathway and a general pathway. How many of you are overseas trained doctors with a moratorium? Have we got any? Just a couple. If you've got a moratorium and you don't have an exemption for your moratorium, you will have to apply for the rural pathway. But you can choose to follow the RACGP or ACRM. Does that make sense? It's one or the other, and it's up to you and your personal choice. If you are Australian trained, you can choose the general pathway or the rural pathway. It depends on you and where you want to work and where you see yourself as a practitioner at the end. Okay, I hope that makes sense. So if you're considering doing RACGP, you could join through the general pathway or the rural pathway. If you are considering ACRM in WA now, all ACRM training is on the rural pathway with the AGPT. That came in 2018 going forward. How do you apply? You must have general registration by the time you join and put your application in. So those of you who are interns, you can still apply this year because we would expect your general registration to be organised and ticked off by the beginning of next year. If you're an overseas trained doctor and you're going through the AMC pathway, you need to make sure that your general registration is all squared away before you are due to come on to the GP training program. Okay. How does it work? So applications are opening really, really soon. ACRM and the RACGP have a slightly different application process. Both of them cost around about $700. So if you're keen on doing both, it's going to cost you $1,400. Otherwise, pick a college and follow them. ACRM, you need a written submission, and then there will be an eligibility check. RACGP runs the Clinical Applied Knowledge Test, which is like a situational judgment test, and a test based on an intern's level of medicine. Okay? And that is going to be sat between the 27th to the 29th of June. So if you do put in an application to become a GP registrar, let your medical administrators know that you're pretty confident that you'll be sitting the CAC test on one of those days in WA so that they have advance warning that you'll need professional development leave for that period of time. After that, both colleges do run an interview process, and this year we've been told we have to run all of the interviews in the 1 week, so it's going to be very, very tight. We know it's going to be hard for you and your hospitals, but unfortunately we've been given the dates and WAGPET just has to manage it for everybody in WA. So as soon as you know, we ask that you liaise with your hospitals and let them know that you've got your interview time and date so that they can work on managing some relief for you in the hospital to allow you to go and attend the interview. Then you'll know by about August whether you're successful or not, and we'll let you know by the beginning or the end of September whether we expect you to do a hospital year with us for 2020 or whether you're one of the lucky, there's about 30 GP applicants each year who have been around in the hospital for a very long time and don't really need much more exposure, and they were able to start in general practice immediately at the beginning of 2020. Okay, now what I might do is let Georgia take over and tell you her story, and then we'll take some questions at the end.